Hey everyone, Dr. Hales and Dr. Parker here. Thanks for joining us for part 3 of our Dental Emergencies series. So today what we're going to talk about is a broken tooth. So I've never broken a tooth. Have you ever broken a tooth?
I have chipped a tooth, yeah. I'm going to say it's a chip. It wasn't broken.
That's broken though, you know. They can range, like I said, from a wide variety, right? A little chip to breaking the tooth in half. So Dr. Parker is going to review some of the things about what to test if you have a broken tooth, small or big, and then how you can relay that to us.
Yeah, so when you break a tooth, we as dentists, we want to know whether or not we can save that tooth and fix it, and how we're going to go about fixing it. So there's several things you can do on your own first, or just after you call the dental office, so that way you can give them a better idea of what's going on. They can be better prepared, and you can have a better outcome in the end on the fix. So first thing that you need to check is make sure you're okay. Obviously, if there's some sort of trauma, make sure that everything else is all right, because we can fix teeth in pretty bad circumstances. So make sure yourself, other things are all in good shape. And once you've done that and assessed that, now you can start looking at your teeth. So first thing you want to check is the tooth wiggly, right? So if you're touching the tooth, if you're feeling it with the tongue, is the tooth wiggling? If it is, stop wiggling it. You don't need to wiggle it anymore. But we want to get that tooth stable, and knowing whether or not it's loose is really important for the dental office to be prepared, so that way as soon as possible they can get that tooth stabilized. If it's broken and it's not wiggly, is it bleeding? So are the gums around it bleeding? Is it bleeding from the center of the tooth? Those are important things for the dental office to know as well. After you've done those first kind of initial assessments, then we can start going into the sore tooth tests. So drinking something cold or having something cold, is that causing sensitivity on the tooth? Tapping on the tooth, is that causing dull ache or sensitivity? And then biting on the tooth, is that causing dull ache or sensitivity? If any of those tests are positive, or if they're negative, letting the dentist know is very helpful. Finally, until you can get into the dental office, because sometimes you won't be able to get in right away, you want to make sure you keep that area as clean as possible. Sometimes a broken tooth can get broken down into the gum line, and if those gums start to become swollen or infected because they're not being cleaned, then it can be very difficult to assess and manage the tooth in the office. So do your best to gently and thoroughly keep the area clean. You can do that with brushing, flossing, or mouth rinses. And then if you can, snap a photo of the tooth and send that over. Here at our office, we've got a text line. Also, you can reach us via cell phone on our emergency line, and you can send a text photo of the tooth over to us, and that helps us even more. So that way when you show up, we're ready to rock and roll, and we can get you an accurate estimate and an accurate idea of what needs to happen to fix the tooth. So hopefully you never end up in this situation, but if you do, we're here to help, and we're happy to do it. Thanks so much.
Thanks.